Adams County is trying to tackle a growing problem that's impacting babies.
Yeah, it's changing the way that pregnant women are screened for syphilis. Gabriela Vidal is your reporter in Adams County and shows us the problem.
It's very disruptive to start one's life already with this burden on board.
A burden that Adams County Medical Officer Bernadette Albanese says she's seen time and time again. Syphilis affecting the life of a newborn baby.
I've had to do the diagnosis, work them up, do the spinal tap, find out if it's affected their spinal fluid or their brain, examine their eyes, treat their pneumonia, treat their liver disease. When you have babies who are severely affected, those are the kinds of things that we can have really problems with.
Between 2017 and 2023, congenital syphilis increased more than 900% in Colorado, with Adams County having the third highest syphilis rates among I-25 corridor counties.
I think the biggest thing is that it's a very treatable disease.
Up until now, pregnant women were only required to be tested for the disease once during the first trimester.
So you test, and if it was negative, they were done. Now, it's just simply not working.
Albanese says the disease could still unknowingly creep up later on in the pregnancy, putting the baby's life at risk of complications or even death if not treated quickly.
I've had several patients over the last few years come in with positive testing that they weren't expecting, and that was a surprise to them.
But with a new public health order that took effect last week, a minimum of 3 tests are now required throughout the course of a pregnancy.
First trimester or entry into prenatal care, during the third trimester, and again at delivery as sort of the last check.
Even women who don't have prenatal care will still have access to testing, now with requirements for urgent cares and emergency departments to check for the disease if they have a pregnant patient.
We're able to treat it and prevent it from being passed on to the baby.
State Representative Julia Marvin says lawmakers hope to take testing changes a step further, with a bill that would give the Board of Health authority to improve testing requirements in the future, reducing the disease's footprint in the community while lessening the stigma behind syphilis.
So no one should be embarrassed by it.
In Denver, Gabriela Vidal covering Colorado First.